Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the Quadratus Lumborum muscle. The Quadratus Lumborum is involved in a lot of back pain and can be overlooked. It's a postural muscle, so it holds the body upright. It will hike the hip up, and it will bend you to one side if contracted on one side, and can be responsible for leg length discrepancies. So if you have done any heavy lifting and over contracted that muscle with that pull and that postural strain, that can develop trigger points in that area. Just sitting for a long time, standing for a long time can cause that muscle to engage. And if you're not using your butt muscle to stabilize the back, that muscle tends to overwork and can develop trigger points. Those trigger points can refer down into the buttocks region, so the top of the iliac crest, the top of the hip, in the buttocks area, deep in the butt, or into the side of the hip on the trochanter, which is the bony area that sticks out on the hip. So this muscle goes from the 12th rib, and you've got two floating ribs. If you go down your rib cage, you'll find that you'll get to the bottom of the rib, and then you'll find a pointy end of one of your ribs that's floating. That's the 11th rib. And then if you walk around to the back, your 12th rib is much smaller, and it's going to attach to that rib and to the transverse processes of your lumbar spine. You've got 5 lumbar vertebrae, so it'll attach down into those vertebrae. So go to that bottom rib. It's going to attach to the transverse processes. Those are the wings of the bones of the low back. So you'll feel that muscle coming from the side. So if I go into my side and I feel that muscle tissue in those bony areas, that's where it's attached. And then it attaches to the top of your iliac crest, the top of that hip bone. And it is going to pull you to the side, pull you into extension. It's trying to hold your body upright. So if you feel a lot of tension or tenderness in that muscle group, it's made up of 3 parts, but it's referred to as the Quadratus Lumborum, and it's that muscle that goes from the 12th rib, attaches to the lumbar spine, and to the top of the iliac crest. So when I release those trigger points, what I'm going to do is go in at an angle from the side, and I'm going to use a golf ball. So I'll take my golf ball and I'm going to find those areas, and that's where I'm going to apply pressure. To get that pressure, I'm going to lie on my back and bring my knee up into my chest. So I'm lying on the golf ball. Sometimes it just disappears. So what you'll do is you want to bring your knee up to your chest, and you're going to go over to the side until you feel pressure into the muscle belly there. You want to hold that for about 20 to 30 seconds to let the trigger point release. You may feel the referral of the pain down into the buttocks region if you're on a trigger point in that Quadratus Lumborum muscle. And you can work on different areas. So I can move that golf ball down slightly and then go over to the side, and I'll feel the pressure into the transverse processes where that muscle is attached, and then rocking back out of there. So I can spend 2 minutes working on the fascia and the muscle trigger points in that Quadratus Lumborum muscle. And once you release those trigger points, you then want to stretch the muscle. To stretch that muscle, what I'll do is I'll lie on my back, keep my knees bent. I'm going to bring my arms behind my head or in a Y position. If I'm going to stretch the right side, I'm going to cross my left over my right leg, and I'm going to pull my knee over to the left. I should then end up feeling the stretch on that right side. I'll hold here from 30 seconds to a minute. Come right out of that, and I can go right back into that and hold again. And I can do that up to 3 times. The 3rd time, you want to just get your knees to fall lower and lower, so that you're getting that muscle tendon length relationship restored by stretching the muscle after releasing the tension in those trigger points. This muscle is used quite frequently with just the posture, so it is usually not strengthened. And if there is an imbalance in that muscle, it creates or can create leg length discrepancies that are functional leg length discrepancies. So you can correct that by changing the muscle tension length relationship in that by releasing the tension and stretching and restoring it. So that is one way you can address low back pain if the quadratus lumborum is involved in the low back pain, which is commonly involved. So it's a good muscle to address. And again, it can refer pain down into that buttocks region at different locations. I hope this is of help. Have a blessed day. Thank you.